Ayushri Khadka hereby stand in front of you all to speak on the topic, If I Were the Health Minister of Nepal. Let me start with a quote by Winston Churchill. I quote, "Healthy citizens are the greatest asset any country can have." I unquote. COVID-19 is an infective disease that has transformed to be a global pandemic. It has infected and killed numerous people around the world. It has disrupted various sectors like education, health, transport. Ladies and gentlemen, now the question is, can we say that our government has not made any efforts? No, we cannot completely say that our government along with health ministry hasn't made any efforts. They have made efforts which are to be appreciated, but due to some lackings, their efforts are overshadowed. And I support and appreciate the government along with health ministry for the following reasons. Establishment of quarantine and isolation facilities in required area, making citizens aware of the pandemic, importance of social distancing and sanitizing. Immediate implementation of lockdown all over the country. Procurement of testing kits from China. Establishment of corona-specific hospitals. Although the government has been making numerous efforts, the situation is still not under control. Ladies and gentlemen, if I were the health minister of Nepal, I would take the following actions to minimize the impact of COVID-19. Firstly, I would expand testing facilities and ensure adequate number of testing kits. The only way to know if an individual is affected or not is by testing. In some cases, testing is not given much priority, due to which the infected person is not tested, which may result in spreading. In some cases, the government and the doctors wish to test, but due to lacking of testing facilities, they lose this opportunity. Similarly, I would have regulated the international borders and entry points in the initial days of COVID-19 crisis. The Nepalese people working in India had been allowed inside Nepal without being quarantined and tested. They went to their homes and everyone that came in contact with them became infected. Moreover, I would create transparency in all government expenditures related to COVID-19. Nowadays, according to different media hubs, irregularities are shown in medical equipments procured by the government. This has resulted in less faith of citizens towards the government. The only way to gain trust of the citizens during this pandemic is by broadcasting the prices and items bought by the government related to COVID-19. I also think this point is important. I would take an additional initiative to enhance government-to-government liaison in order to seek additional help. Nepal has a poor economy, and the economy has collapsed more during during this during this pandemic. Nepal cannot control COVID-19 all alone. So I would seek help from other foreign countries in the form of medical equipment, money, etc. I would also ensure allowance to all frontline workers like health workers and security forces. All the frontline workers are doing their duty without caring for their lives and family. To praise and motivate them, allowance should be provided. I would also establish additional quarantine and isolation areas with all required facilities. Moreover, I would procure adequate medical equipment like ventilators on time. Due to unavailability of required medical equipment, many people are likely to die in future. So, if adequate medical equipment are provided on time, maybe we can save more lives. Lastly, I would ensure every individual arriving from foreign land is quarantined and tested before entering the community.
This is me, Prarma Bhandari from grade 7, here to present some of my points in order to control or minimize COVID-19 cases as a health minister of Nepal. Efforts that the government of Nepal has been doing through these days to minimize the pandemic of COVID-19. To minimize the spread of this virus, lockdown was implemented by the government of Nepal. Regular screening of people at the airport and facility of quarantine for them. Management of PCR testing, quarantine facilities, and health workers in each province. According to the density of different districts and provinces, various health workers, PCR testings, facilities, quarantine facilities have been managed by the government of Nepal, and the other is formation of the committee to supervise and handle the COVID-19 cases. So the health ministry has formulated a committee to supervise and handle the COVID-19 cases. Like a committee was formed, named CCMC, COVID-19 Crisis Management Center, and allocation for controlling and managing the COVID case. So budget of 13 Arab has been created by the health by has been raised in order to manage the COVID-19 by the government, and the other is creating awareness through various means. Health other is ensure adequate distribution and product of oxygen to the designated hospitals and establish temporary COVID-19 hospitals where necessary. And if I were the health minister of Nepal, I would firstly I would make lockdown beneficial by involving security levels like the army and police, manage transport of goods and services in Nepal-India border, and migration of people by coordinating with representatives of India. I would have a diplomatic talk with the high level of government of India uh, and manage the a safe entrance of all the good and services from India. And I would not lead the Nepalese people in India or Indian people to enter border of Nepal. And what I do is I would manage a safe quarantine facilities, and government of Nepal would take the responsibility to fulfill their basic requirement, and they would be sent to their house in a special COVID bus only when they were tested negative. And the other is prohibit internal and external migration and stop the international and national flights as form a committee of health experts to minimize this pandemic. I would consult with all the health workers and form a committee of all the health experts where we would formulate different plans and also manage a helpline center where citizens would directly share their problems with us, and we could try minimizing their problems. Distribute necessary equipments and provide safe quarantine facilities according to the needs and requirements of each province, and follow international practices to overcome this virus. I would take talk to all the health workers and hospitals of every district in order to manage sufficient beds and isolation facilities for all the COVID infected patients, and vaccine queue as fast as possible. So the other is proper utilization of budget allocated for control of COVID-19 cases. Spent, for example, recently in the news where it was mentioned that the government of our country gave 73 crores to the organization of snake rearing to our past prime minister, which was unnecessary spend of budget. So instead of spending our budget in these things, I would properly utilize them in these crises. Facilitate food to all the needy people by instructing municipalities to establish a food bank. And the other is provide allowance to those who are suffering to sustain their life and suffer these pandemic. But during this 5 to 6 months of pandemic, I would manage allowance for all the needy and unemployed people, increase PCR testing, preventive measures, and diagnostic strategies in each district. So, encourage private hospitals to change it in COVID hospitals. Motivate health workers and officials by providing them monetary and emotional support, and also ensuring that their safety by advising to use preventive measures. Organize a program where citizens can directly contact me through telephone so that I can understand their problems and find measures to solve them. So what I would just do is I would organize a program named like a helpline center where the citizens who are having problems through this pandemic would directly contact to me, and I would find the possible measures to solve it.
So I support the government and health minister for the following reasons. For declaring lockdown in all countries, for bringing testing kits from China, for opening communication services available for reporting about the pandemic, for building more places for COVID tests and places for corona patients. Although government has poured its all effort and ways to control over COVID-19, it is still affecting people in many ways. Many laborers who earns money by their hard work for their livelihood are now starving through hunger. Many people are dying due to hunger. Many people are committing suicide. Why? Because government is not being responsible towards this. We people ourselves are helping others through media and apps. The government is unable to take control over coronavirus but to spread it in the country. If I were the health minister, if I were the health minister, I would have done, but not limited to this thing, a proper and well assessment of the threat posed by COVID-19 since the very beginning, coordinating within the health ministry and beyond, the exact national infection department like Center for Disease Control in the US, Health Ministry of China, and other European countries. Number two, I would have strongly urged the PM to prepare for war-like scenario to combat COVID in terms of expanding healthcare facilities, medical supplies, and personnel. Number three, I would have never suggested going for a complete lockdown all over Nepal, like we had witnessed, but go for the area or district prohibitory model since the very beginning, as it was implemented in populous nations like Pakistan, Philippines. Since we have a huge percentage of people earning their livelihood from daily wage. Number four, I would have strengthened health diplomacy, which is effective to reap the benefit from donor countries in the areas of guidance, strategy, medical supplies, and medical personnel. What would I do? The main thing that I would have done is to secure the possible promising vaccine, which is under trial by making a deal of purchase or make negotiation with the country to get that in huge subsidy at the earliest. Number six, I would have better communicated with the people with professionalism and tell them things that we have been doing, listening to the criticism for improvement and taking feedbacks to better ourselves to counter the challenges posed by COVID-19. I would have particular focused on behavioral change advocacy to make general public aware of the intensity of this disease and to urge them to pay extra attention to hygiene and sanitation. I would increase contact tracing, increase tests, and increase isolation facilities. Number eight, I'd work with the government to give more incentive to frontline health workers for their service during this period. Number nine, I'd mobilize health volunteers large quantity to raise awareness in village against COVID-19. Number 10, I'd promote healthy lifestyle among citizens like importance of balanced diet, nutrition, and exercise to help them build better immunity system. Number 11, I provide free public health service to people. Let us all be together and move forward with government. Let us all follow the rules and obey government's decision as well. Let's support and help our real heroes, doctors, police, scientists, and cleaners for working hard against COVID-19 and protecting us. Stay home, stay safe. Be safe, our family safe. Thank you.
I will do traffic limitation in both sides of the border of China and India. I will not let Nepalese people to go out of the country. If any people is suffering from COVID-19, I will put them in strict quarantine. In every ward section, I will do COVID-19 testing if anyone is infected or not. I will make limited laboratories for testing and limited stock of medical supplies. For response, which includes personal protective equipment and other supplies. For the people, the masks, gloves, and sanitizer will be provided in minimal cost. In my opinion, giving free make just waste of those all things. In case of Nepal, about 25 of people are below poverty line, so there would not be lockdown. Lockdown means just like curfew. People are not allowed to move from one place to another. Economy will be stopped, which means which means education service, transportation service will be stopped. People are not allowed to do anything, just staying at home, which makes them mentally retarded. Many people business will be stopped. That makes to do them suicide, which recently has happened in case of Nepal.
As the COVID-19 disease was named as the world pandemic, it has completely uplifted the economy of the entire world. It has not just affected health sector but also other sectors of lockdown, stopped the domestic and international flights, management of quarantine centers and health center, imposed security like armies and police to make the lockdown benefits from a community of health expect for the minimization of the virus, compulsory to wear PPE suits and face masks for each and every individual, proper organization of quarantine center in all places, requirement amount of medical sources required for the test of the virus, strict rules and regulations regarding corona public awareness.
In order to effectively conduct the testing, I would have installed testing sites at the different geographical areas. Those people who have lost their job, I would have provided them enough food by different means of donation. Though there were few things I want to do as health minister, I totally agree with the current health minister, Mr. Bhanu Bhakta Dhakal, decision like distributing food to the needy people, not shutting down the economic activity, which would be affected even more, shutting down all the places where large amount of people usually gather, like cinema halls, malls, big restaurants, etc. As we can see in the figure, citizens of Nepal had been to India for doing employment. Due to the improper management, they are stuck in the India while they want to return to their home country.
I support the government for the following effort: declaration of the lockdown all over the country, bringing testing kits from China, awaiting people to be safe from virus by following the method, establishment of quarantines. If I were the health minister of Nepal, I will take the following actions so as to minimize and control the expansion of this COVID-19. I will make the list of poor people and serve them food and money because people are dying due to the hungriness. I will do the declaration of lockdown. I will bring the safety in the country, provide the required materials to be safe, establishment and the quarantine. I will stop people to travel from one district to other district without safety. Let's be together and follow all the rules and regulations given by the government against the problem. Let's be safe.